But cardiologists have been looking at this score for a long time, and multiple studies that looked at heart rate recovery have shown that if you have a heart rate recovery score of less than 12 within that 1 minute of stopping exercise, then it's associated with anywhere from a 2 to 4-fold increase in risk of death. The good news is that this is a completely trainable metric, and it's actually a marker that many fitness professionals use as part of their conditioning regimens. This article talks about Steph Curry's trainer and that how one of his secrets of success was that his conditioning was so good that Steph could play really intense basketball, and during a timeout, during that 90 seconds of a timeout, Steph could go from a heart rate of 130, 140 beats per minute and get it back down to 80 beats per minute just in the time that it took for that timeout. But even though this trait is modifiable, experimental studies have shown that if you do something to silence the vagus nerve at the level of the brainstem, then exercise is no longer going to provide you that benefit of improved heart rate recovery. In my opinion, when you're doing cardiovascular activity, not only are you exercising your heart, not only are you exercising your muscles, but you're also exercising your vagus nerve and your vagus nerve's ability to combat and modulate your sympathetic nervous system. When you're at a high level of exercise intensity, it used to be thought there was a complete vagus withdrawal, that the vagus nerve was silenced, but experimental studies have shown that even though there's a decrease in vagus nerve activity, there's still enough discharge of the vagus nerve in order to keep control of your heart rate at those highest levels of intensity. And I believe that when your vagus nerve is working at that level of intensity, that is also providing a neuroplastic change to the vagus nerve's output that allows things to not only control your heart rate at the time, but also practice so it could keep control of your heart rate even when you're at rest. I understand some of the frustrations that people have with heart rate variability as a metric, because for some people that measurement just doesn't really change no matter how much cardiovascular activity that they're doing, and even though they seem fitter, that score isn't really moving that much. And even though we shouldn't be exercising for the sole purpose of trying to change a metric on your phone or on a wearable device, for some people it's an important measurement for them that keeps them motivated to do some of these cardiovascular activities. So if you are one of those people that is motivated by that and you want to know that, hey, the exercise that I'm doing is having a beneficial effect on your autonomic nervous system, then maybe switching gears towards measuring heart rate recovery during your fitness journey might be a suitable way of measuring how your autonomic nervous system is changing, particularly as it relates to the vagus nerve.